When was the last time you checked your blood pressure? In Africa, 36% of adults aged 30 to 79 are living with hypertension, also known as high blood pressure. Now, what makes this even more concerning is the fact that most people living with hypertension don't even know that they have it. In today's Facebook Live conversation, we will talk about why hypertension is a concerning challenge in Africa, some of the factors, lifestyle factors contributing to it, and what we can all do to prevent, manage, and control it. My name is Marian Tabi, and joining me today to talk about hypertension and to answer all your questions on it today is Dr. Kofi Nyarko. He is the team lead for non-communicable diseases at the WHO Regional Office for Africa. Hello, Dr. Kofi. Welcome.
Thank you, Mariam. Thanks for having me.
Yes, Dr. Kofi. Dr. Kofi, we are talking today about hypertension. In simple terms, what is hypertension?
Hypertension is also referred to as high blood pressure, but to make it very simple, you know that the body is made up of blood vessels, which blood passes through and is pumped by the heart. When this is pumping every day, that is what keeps us alive. But once it's pumping through a vessel, it's like water passing through a pipe. When the pressure goes beyond normal, that is what is called high blood pressure. It means the pressure in the vessels, our arteries, is higher than normal, and it can cause so many devastating effects to the body. Thank you.
Wow, thank you so much. But in explaining what hypertension is, how will an individual, how does one know that they have hypertension?
Thank you for this question. It's very important. I'm sure most of you have heard that they say hypertension is a silent killer. When you have high blood pressure, most of the time you will not know. It is asymptomatic. It means it has no symptoms. You can have high blood pressure for 5 years, for 10 years, for 15 years without knowing, and all of a sudden, you can have a devastating effect, such as cardiac arrest, heart attack, stroke, or even death. And as was said, about 40% of people in Africa are having hypertension, and half of these people don't even know. And most of the time in our facilities, people come in with stroke, they die. And most of them, I would say, they even die without knowing that they had hypertension. So it's a very serious condition, especially in Africa.
Wow. Now, what are I know that you've moved on to explain like some of the implications of people not knowing, but I want you to also explain what are some of the risks if for sustained hypertension and if it is left untreated.
Okay, before I go to that, I would say that why is it that in Africa especially, most people don't know that they have hypertension. We can look at our lifestyle, especially in Africa. We are not used to regular medical checks based on our stigma. People don't want to go to facilities to check their pressure because they associate going to health facility with being sick. But with hypertension, as I said, you don't know that your pressure is up. So you're apparently healthy, but you have high blood pressure. So it's our social, cultural beliefs in Africa that has given rise to most of the people with hypertension not knowing, and they just end up with these complications. There are 4 main things that contribute to high blood pressure. And first, I will talk about our diet, unhealthy diet. A diet full of salt with fats will cause our blood pressure to go up. Another one is physical inactivity. When we have sedentary lifestyle, we don't exercise a lot. The other 2 important ones are alcohol. Alcohol consumption is not good. I know most of us like alcohol. Alcohol consumption is not good, and also tobacco use, smoking. So these are the 4 main things that increase our risk of having high blood pressure. So we need to have an ideal weight. If you eat well and you exercise, you have the ideal weight to prevent you from having high blood pressure.
Thank you so much, Dr. Kofi. You've even explained some of the lifestyle factors, especially in Africa, contributing to hypertension. But moving on from that, can you explain some of the simple steps individuals, maybe if you are out there watching, that can take? What can they do to be able to manage, prevent, and control hypertension?
Okay. First and foremost, we will look at our diets. We need to have healthy diets. We need to reduce our fats and oils. You have to be conscious of what we eat. We have to make sure that we exercise regularly, at least 30 minutes of active exercise most of the days in the week. We have to ensure that we cut down on alcohol or even stop consumption of alcohol and tobacco use, not only smoking. We use tobacco for so many things. Some people chew tobacco, they use it for so many things. Tobacco use increases our high blood pressure. And as we said earlier, you know that in Africa, most people don't know that they have hypertension. And you just be driving and you just have a heart attack and you die. So the most important thing for Africa is that we should have regular medical checkup. We need to check our blood pressure regularly to know, because if you have it, you will not know. And most of the people don't know, and I'm sure most of the adults listening to us now, most of you may be having high blood pressure, you may not know. So you have to check your blood pressure, and that is what we say, know your numbers. Every adult, you should know your numbers and make sure that once you have high blood pressure, you take regular medications to bring it down with good lifestyle modification, and you'll be able to manage it. And if everyone knows their blood pressure and they take their medicines regularly, I can assure you, you have very small number of people who may have stroke or have cardiovascular disease. But in Africa, we are not aware. People are so busy. They don't go to facilities. They don't check their blood pressure. They are always busy moving along till they die. The irony is that I'm sure all of us watching, one or two people in your family may have died of stroke or heart attack before. You know, but it's worrying that most of you know that somebody or a friend has died with a high blood pressure condition, but still you are not checking. Yeah. So let's all check our blood pressure regularly and ensure that we have a healthy life.
Wow. Dr. Kofi, can you explain what is a normal blood pressure range? You spoke about knowing your number. So what is considered normal?
A normal blood pressure is a range, but usually when you have, we have two numbers. We say 120, 80. When you check your blood pressure, you have the higher number and the lower number. The higher number is around 120. If you have anything beyond 140, it's worrying. And the 80, if you have anything beyond 90, for the lower one, is worrying. The higher one, we have systolic and diastolic. I don't want to go too technical. So you need, and also based on your age, your sex, and your lifestyle, there could be some variations. So once you check, your health provider or your doctor will be able to advise whether based on your condition, your pressure is normal or not.
Okay, thank you so much. Now, moving on, you are the team lead for non-communicable disease at the WHO Regional Office for Africa. I want you to be able to highlight some of the challenges that countries face in diagnosing and managing hypertension.
Thank you very much. Maybe I'll look at four main things. As I said, there's low level of awareness, and because there's low level of awareness, there are not available diagnostic and devices in our facilities, especially in Africa. And at times when somebody even wants to check their blood pressure, the facility is overcrowded. You'll go and sit for hours and you'll not have access to measure your blood pressure. So limited diagnostic devices in our system, also limited health workforce. The nurses and the doctors who will check your blood pressure, we have a workforce challenge. We also have what we call system infrastructure, especially in Africa, that we don't have the adequate infrastructure to take care of all the numbers that we have. So these are the system-wide challenges, and also having what we call policies and guidelines to guide countries. Some countries still do not have the adequate policies and guidelines to do. And this is where WHO comes in to support countries to fill in these gaps.
Thank you so much. Moving on from countries' challenges, now at the regional office, as team lead, what is the support that WHO is giving to countries to be able to improve the detection, management, and also control of hypertension?
Thank you very much. This is very important, and that is mainly what WHO does. Our main role is normative guidance and providing technical products. So WHO has provided the guidance documents, guidelines to support countries to come out with strategies to implement this. And WHO has what we call the package of essential non-communicable disease interventions called the HOPEN. We have the PEN Plus. We have all these what we call integrated service delivery, so that when an individual goes to the facility for a headache, for example, we look at the individual as a whole. We call it a person-centered care approach, so that we don't have missed opportunities. So these are the guidance that WHO has given to countries, and we have supported countries to develop their policies in line with that, so that you'll be able to implement the package of NCD interventions, which is an integrated person-centered care, so that we can give holistic care to the individuals in our region. And we have done this, and it's gaining momentum, but there's still a lot that needs to be done.
Okay. Thank you, Dr. Kofi. We are coming to the end of this conversation, but I want to also give you the opportunity to, if someone you want to give like one message that you want our viewers to learn or know about hypertension today, what will that message be?
The key message is that hypertension is a silent killer, and you will not know whether you have hypertension or not. You will need to check and check regularly and know your numbers. With that, you can save your life, you can save the life of your friend and the life of a family member, because hypertension and its complications have catastrophic effects on the family. If you are sick with hypertension or you have complications, you need somebody to come and take care of you in the family. So it has a very long devastating effect. Not only you, it affects the whole family, the family income and everything. So once we take care of hypertension, we can really improve even the national income of the country, because hypertension or cardiovascular diseases, if I've not said it, is the main cause of mortality in Africa, is the number one cause of death, especially amongst adults. So when we deal with our heart, blood pressure, we have a long way to go to improve the health of our people in Africa.
Wow, thank you, Dr. Kofi, for highlighting most of those information around hypertension. And thank you to you, all our viewers, for engaging with us today. As Dr. Kofi mentioned, know your numbers. And the only way to know your numbers is to check your blood pressure regularly. So share this information on what you've learned today. And until next time, goodbye.